Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Welcome to this training video on Ideal Practice Workflow Part 1, your front desk, the workflow of your front desk. This is the first part of a 3-part training series. Part 1 will be focused on the front desk. Part 2 will be focused on the actual clinician, which is the documentation. And Part 3 will be focused on the biller. Now here's Ideal Practice Workflow. Simple. Patient walks in. The front desk verifies eligibility for the patient online. If online eligibility verification is not available or is not an option, then manual eligibility verification is done right over the phone. Which are the circumstances in which online eligibility verification is not an option? If the insurance company, that is the payer, doesn't have the ability for online eligibility verification, it's not going to be available. Some payers do have online eligibility verification, but they do not have online eligibility verification for certain service types. For example, physical therapy, occupational therapy. They just don't have that capability. Now in intouchbillerpro.com, if the payer has the capability, we have the capability integrated into our software because we work with thousands of payers all over the country. So within intouchbillerpro.com, the front desk can within seconds check online eligibility for several payers, not all payers, but for several payers across the country, which will save the front desk the need to make a phone call and to do manual eligibility verification. So that's step 1 in ideal practice workflow for the front desk staff. In addition to that, the front desk staff, once they do online eligibility verification, should be able to click one button, capture all the information for that patient automatically from the insurance company, with the patient's permission, of course, because the patient has to sign off on a HIPAA release form where they allow you to access their information from the insurance company. That's a responsibility of the practice to get that information in writing from the patient. But if the software has the capability to actually capture that information and create a patient chart automatically, that power is huge, because now the front desk doesn't even need to enter the demographic information of the patient. It's automatically captured from the insurance company. I hope you can understand that that's extremely powerful, because on the one hand it saves time, on the other hand it minimizes denials, because the information is coming directly from the insurance company. So there's no, there are going to be no issues like wrong information entered, wrong date of birth entered, incorrect spelling in the address, things like that, because as you know, that leads to denials. Okay. Now in addition to that, once the patient chart is created, once the patient record is created in the billing software, the front desk should be able to click one button to schedule the patient. Once the patient is scheduled, now that scheduled patient should appear automatically in the EMR. And by the way, that's where I talk about Ideal Practice Workflow Part 2. But once the patient is scheduled in the EMR, the job for the front desk is done. Once again, patient comes in, online or manual eligibility verification, patient chart creation with the patient demographics, not patient intake. That's a separate thing. That's part of what the patient's supposed to do themselves. And in fact, we have a capability to streamline that as well using an iPad application. But once the patient comes in, like I said, the eligibility verification online or manual eligibility verification, patient chart creation, and the scheduling of the patient. The front desk does this. This is Ideal Practice Workflow, and this is part 1 of our 3-part training series. In the next part, Ideal Practice Workflow Part 2, I'll teach you about how this can work hand in hand with the documentation component, which follows next in the practice workflow. Thank you so much for watching, and I'll see you in the next training.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.